Hello, my friends. Welcome to my YouTube channel. My name is Dr. Said Kazmi, and this is going to be a short question answer session. And these questions have been sent by some of my friends, and all of these questions are actually related to this new COVID-19 vaccine, especially the mRNA vaccine produced by the Pfizer BioNTech. So there are so many questions which I've tried to group together so that it becomes easier for me to answer these questions one by one. So I will go through these questions and I will try to answer that in a very simplified manner. So the very first question that has been asked is that can messenger RNA vaccine like the Pfizer BioNTech vaccine, can it give someone COVID-19? So this is probably a sort of worry by some people that they think that they might get COVID-19 if they get this vaccine. Now, the answer to this question is no, not at all. This is biologically impossible because this messenger RNA vaccine produced by the Pfizer BioNTech, this messenger RNA only encodes for the spike protein. It does not encode for the whole viral genome because you need the whole viral genome to cause COVID-19. You cannot get COVID-19 only by the spike protein. So, no, the answer to this question is you cannot get COVID-19 by having this vaccine. Okay, so that should make it very clear. Question number 2 is if you are given a messenger RNA vaccine, can that result in a positive COVID-19 test, which could be a nucleic acid or antigen test? So people are asking that if they get the vaccine, and let's say if they test after getting this vaccine, can this vaccine give them a positive COVID-19 test? Again, the answer is no. This simply cannot happen because if you get a positive test, that is basically based on the PCR test. So the PCR actually quantifies the viral genome. And here you are only getting the mRNA vaccine, which will just produce the spike proteins. So if you test positive after that, that would be a new diagnosis of COVID-19 and it would not be the effect of the vaccine. So this should make it clear. Number 3 is the question that has been asked is routine COVID-19 tested needed prior to receiving the COVID vaccine? That do you need to be COVID free? Do you need a test before getting this vaccine? No, you don't need a test at all. Irrespective of your past status, you can get this vaccine anytime. Okay, question number 4 is do you need to follow all usual public health guidance after receiving the COVID vaccine? That do you need to follow all this like preventive things like social distancing, mask, washing your hand? Yes, absolutely. The trials of messenger RNA vaccines, they have shown that they reduce the severity of the infection, but it has not been proven that they prevent asymptomatic infection. So it's important that still, while you have got this vaccine, you should still do all those preventive measures. So washing hands, so they say as like hands, face, and space. So you should be following those advices. Then another question is how long the typical post-vaccination symptoms last. Like people are asking about headache, fever, and for how long this should avail. That should be less than 2 days. So it should never go beyond 2 to 3 days. So in most cases, it would be less than 2 days. And another question is related with this question. They say, like, what are the typical post-vaccination symptoms? Well, the typical post-vaccination symptoms are the same symptoms that you can get with any other vaccine. And one good example is the flu shots. Like you can get headache, myalgias, a little bit of fever, and a bit of fatigue. So that you can also get as a side effect of this vaccine as well. And as I told you, it should last less than 2 days. Another question is they've asked, what happens if I miss the second dose, that is the 21st day dose? Well, ideally you should not miss the second dose because it's important to get the second dose on time. But let's say if you have missed the second dose, then obviously the first dose does not need to be repeated at any time. When you get a chance, you should get the second vaccine of COVID-19. Another question is quite interesting one, and probably I was scratching my head on this one. Somebody has asked can I mix and match different types of vaccines? So probably they're thinking like if you mix the Sinovac, the Chinese vaccine, with the Moderna vaccine, like one dose of this and one dose of that. So can that be done? Well, I don't think that's the ideal way to do that. I mean, there is no data that supports this. So theoretically, they should be working, but I don't think practically it has got a significance. So that should not be done because we don't have any data on this particular thing. Another person has asked, like, what if I have recently got the flu shot? Well, if you've got the flu shot, you should wait at least 14 days before you get the COVID-19 vaccine because obviously you don't want the immunity to interfere with one another. And another question is, what if I previously had COVID-19 symptomatic cases? So if I had suffered from COVID-19, do I need to get vaccinated? The answer is yes. You're still eligible for vaccination, and ideally you should still get it irrespective whether you had COVID-19 in the past or not. So you still, if you have been offered, you should get it. And another question, this is probably the last question somebody has asked, if someone currently has COVID-19, should they get the vaccine? Now, you see, COVID-19, whether asymptomatic or symptomatic, the thing is that they should wait till they are out of their isolation period. So if they're asymptomatic, they should wait for that 10 or 14 days, depending on the geographic region that you are in, and then you should go for the vaccination. But let's say if you are symptomatic, if you've got symptomatic COVID-19 infection, then you should wait till you are completely asymptomatic, and then you could go for the vaccine. And so these are some of the questions which were asked in different ways. I've tried to group them together and try to answer them. So these answers are quite discreet, and I hope that clears some of the confusion regarding these newer vaccines. So in a nutshell, the bottom message is that these vaccines are quite safe, and if you are given a chance to get these vaccines, you should go for it. Thank you very much for listening to this vlog.